asking.
That's okay. I was just curious.
I've never had anyone just say that and do that, but it's a great idea because the phones today actually are better than probably the picture in there. It's the same. It's a little bit blown up. It's a 19-inch screen. So.
Yeah. No, that's okay. I'm good.
Okay.
But yeah.
Okay. All right.
This is really helpful.
Good.
Because I'll listen. I'll absorb
good.
it.
We're zooming in. We're going to come out of your cervix now. We're looking at that leading edge of the placenta. You see that difference? Can you see that kind of little line?
Yes.
So this is cervix over here. So your cervix is about 1 centimeter from your placenta, which is fine.
Okay.
Okay? Now we're going to go on to the baby. We're going to move away from the uterus. And Jasmine's just, again, measuring for me. Oh, here it's about 2 centimeters. It's a different angle at which she's looking from it.
Okay.
Now let's go on to baby. So first thing we look at is baby's brain, cranium. Cranium should look like an eggshell. You should see little sutures. The suture should be open. This is a suture, that's a suture, that's a suture.
Okay.
A suture over here. The baby's head measures about 19 and a half weeks. You're 19 and 2 based on my dates.
Okay.
Right? It's normal.
So 19 and a half is good. Yeah.
Midline
and actually 19 and a half is what I have calculated on like our date.
Falx cerebri, these are the 2 choroids. So the kid should have a normal, basically, what I call kind of intellect and motor development. It should walk, function, talk, no problems.
This is just all so exciting.
Cisternomagnonuchal fold. So again, your baby doesn't have any abnormal cranial structures.
Okay.
I'm moving fast, a little bit forward. Now we're going to jump down to the baby's abdomen. Again, here's the umbilical cord where it inserts into the placenta, but now it inserts into the abdomen. So that's the umbilical cord insertion into the belly.
Okay.
Stomach, the abdominal circumference, 19 weeks, 3 days. So again, babies that are overly large, macrosomic, are obviously diabetic. If babies are growth restricted, they're small. Those are babies that have chromosome abnormalities. Okay. So just by those 2 pictures, head and abdomen, I know that this baby's relationship, head to abdomen, is 1. It's a normal baby. I'm not worried about this kid at all.
Okay.
This is just a cross-section view looking through the baby's umbilical cord into the abdomen. There should be 2 arteries that branch the level of the bladder. That's called a 2-vessel or a 3-vessel view. So 2 umbilical arteries and an umbilical vein.
Okay.
Femur measures about 19 weeks. It's like a hockey stick. It should look like a hockey stick. It's pretty much what your baby's measures. So by size, 281 grams, 10 ounces.
Okay.
Okay, it's normal.
Femur's 10 ounces or the baby's 10 ounces?
No, the baby.
Oh, okay, so the baby's about 10 ounces. Okay.
So it's an estimate. So we take it a couple of times here. The femur's measuring 19 and 3. So 292 grams, 10 ounces.
10 ounces,
the fetus, 3/4 of a pound. So what I call owl's eyes or the kidneys. You should see the kidneys. You should see 2 donuts. Okay. 2 donut holes, very important.
Yes, very important.
Normal. Oh, very normal. Yeah,
good.
Normal size. 3 to 4 millimeters is normal. Over 7 is enlarged.
Okay. This is fascinating and amazing, and I can't believe this is my little baby
fingers.
daughter. Oh my gosh.
Okay. 2 little tibia, fibula, little arms, little hands, moving hands, fast, look good.
Okay.
This is a little cross section. You don't see it, but if you turn your head the other way, this is actually a face shot, end on. It's actually the chin. We're going to look at that a little closer here in a minute.
Okay.
Come in. Here's the 2 eyes, orbits, nasal bone. Okay. Jasmine's just showing me again. She's kind of showing me the feet and the hands. Hands, gender, femur. Okay, there's definitely, it's 100% a girl.
Okay.
Now she's going within the chest. Now she's looking at the ventricles. This is an apical view. The tip of the heart is pointing up.
Yes.
Left ventricle, left atrium, right ventricle. This area is open. That's called the foraminal valley. It should be open in utero life. This is what's called the left ventricular outflow tract. It's the aorta in a cross section. Okay. Moving forward, again, now we're just looking again, cross-section view, left ventricular outflow tract. And make sure that it's full entirely intact. This is the right ventricular outflow tract. We look at it multiple times. Now we're looking at the offsetting of the valves, the right side of the heart, left side of the heart, tricuspid and mitral valves.
Do they look good?
Everything looks good.
Heart looks good. Brain looks good.
Crossing over, this is aorta coming under. This is the right side of the heart, the blue, this is the left side. So this is a normal pattern of blood flow.
Okay.
Awesome.
All very normal. Little baby's lumbar spine, thoracic spine, you're getting
very important. Yeah. Oh, it's so good. We need to make sure all that looks good.
Here's what I was trying to get at earlier. This is the baby's lips. The lips end on.
Oh my gosh.
Okay? So you have to look really close. It's kind of like pressing up against the window.
Oh, I see what you're saying. So,
top of the lip.
Oh my goodness.
Top of the lip. Okay, so that's how we identify if there's a cleft lip. There's no cleft lip here.
Okay.
Okay.
Man, oh man.
Looking closer, yes, Jasmine, I know it's girl.
Yes.
Yes. Am I worried about you? No, not at all. Actually,
Okay.
Good.
And then the only question I just wanted to ask
Yeah.
in terms of the umbilical cord, so like it was right in front of her head, and I'm sure
it can
it's
move around. So just hear me. It's like 52 centimeters in length when it's full term.
Okay.
It's about 20 centimeters. They're soft. They're gelatinous.
Okay.
There's no harm. Sometimes they go around their head. Sometimes they go around their arms. They grab them. It's soft in utero.
Okay.
Even probably if I was to look, I don't see any umbilical cord there. But back to this picture at the very beginning. Think of your umbilical cord as literally it's the garden of youth. It's where all the nutrients come through.
Yeah.
There's nothing wrong
Okay.
in this
Yeah,
structure,
that looks
okay?
exactly like what it's supposed to.
It's just how it should be looked.
Perfect.
Okay?
You are so helpful, Dr.
Good.
Justus. I
Good.
appreciate it.